Good afternoon. Thank you all for coming. We're delighted to have the reports of the 2013 Rural Scholars. The University of Massachusetts Medical School program and the School of Nursing is a partnership with the Dukes County Health Council. We've been going for, I think it's 12 years now, and we have been really lucky to have increasingly wonderful students here to do some marvelous work. And they will tell you about that and what they recommend that we might be able to do to build on both the work that all of you are doing now in the field, but also what they have been having to look at. Tuff, you going to start? We're going to start with the Healthy Aging Report.
Hi everybody, my name is Cuff Baker. I'm a second-year medical student at University of Massachusetts Medical School in Worcester. The rest of my colleagues will be introducing themselves as they come and take the microphone to walk us through a presentation. We're really excited to be here today. We're talking about our healthy aging research that we did here on Martha's Vineyard. But first, before I get into what we found and what our recommendations are, I'd like to just let you know who we met with while we were here in the past 10 days. So this is a listing that I think is pretty complete of the interviews that we conducted over the last 2 weeks. It might be hard to read. That's because there are so many organizations on there. And you'll be able to see this PowerPoint online later if you'd like to look in more detail. So we want to start by talking about the growth of the senior population on Martha's Vineyard. We have some draft numbers from the Donahue Institute at the University of Massachusetts in Boston, and they show a dramatic increase in the senior population on the island in the upcoming 50 years. You'll notice especially in the next 20 years, there'll be a significant increase in the number of people over the age of 65. Then that will level off, and we'll have, as those people age, a much more significant increase in the population over the age of 85. So that has some implications for how we conduct healthy aging policy on the island, what kind of illnesses we can expect to see, what kind of challenges there'll be on the island. Next, I just wanted to show quickly how the distribution of the population on the island will change over the upcoming 20 years for as far as we have these data forecasted. You'll see in 2010 on Martha's Vineyard, the 16% of the population was over the age of 65. That will gradually grow as the younger population shrinks, and then by 2030, the 65 plus population will be about 32% of the island population. So we wanted first to talk about strengths on Martha's Vineyard. As you are probably aware, there is a wealth of diverse services available here on the island. It's a selling point for Martha's Vineyard. People come here to retire and to grow old because they know there are services here that are extremely valuable. We've even heard anecdotes about people who left the island to move closer to children and then came back because there are so many more resources available here. We also found a very strong sense of community identity, and with that, a committed core of volunteers and professionals who are dedicated to making Martha's Vineyard a great place to grow older. We also found a population eager to roll up their shirt sleeves and find solutions to the problems that we'll encounter here. We also found some points where there's room for improvement. First of all, because there's such a wide array of different services that are private, local, state, federal, there's a huge range of eligibility requirements, and that can be very challenging for people to navigate as they need services. Even experts told us it's challenging to navigate, and it's their job to know how to navigate. We also found that there could be more improved communication between and across the organizations on the island. We'll get into what that means more specifically later in the presentation. We also want to address the lack of resources for caregivers and decision makers who live on the island and off the island. So there are a few themes that came up over and over in the interviews we conducted over the last 2 weeks. First of all, there's a need for a central service that will guide seniors, caregivers, and providers as they navigate the various services available on the island. There's also a need for improved transportation and housing options, both for seniors and for the workforce. So we have a series of suggestions and recommendations that we'll be presenting based on the research we've done through our interviews with people in the community, which includes organizations and individuals who need these services and are using them now and will be using them in the future. And we also just wanted to point out that we'll have some longer-term goals that are sort of things we can start the groundwork for now and build on, and then some short-term, more urgent goals that we think are extremely important to start right away. So the first thing we'd like to tell you about as one of our suggestions is what we call the Seniors One-Stop Referral Service. This name is tentative, but we'll call it the one-stop for this presentation. We want something that will coordinate or help coordinate and navigate the complex problems that seniors, their caregivers, and providers face on the island. So we wanted to start by looking at some existing models for island-wide cooperation that have been very successful here in Martha's Vineyard. First, the Vineyard Healthcare Access Program. Many of you are probably familiar with it. We had an opportunity to sit down with them, and we heard rave reviews from everybody else that we talked to. It's an island-wide program. It's very popular. They work with 15% of the year-round population every year, and they're respected by the organization or by the community. They serve a wide range of needs and populations where people need health insurance for for all sorts of different reasons. And we also found a model in the Council on Aging of Southwestern Ohio, which serves a population of more than 250,000 elders in over 5 counties in southwestern Ohio. They have an excellent website and a staffed phone line that are a point of contact for anybody who's trying to navigate the various services that they might have access to in southwestern Ohio or any kind of federal program. Their goals are to help people stay in their homes and to support caregivers, which are similar to the goals that we found everybody here on the island shares. So this one-stop referral service, we envision being similar to these kinds of models. It would be an island-wide starting point for navigating the services available to seniors here in Martha's Vineyard. It's for seniors, it's for caregivers, and it's for providers. So any of those people, any of those stakeholders in the care of elder people would be able to make this phone call or visit this website. So the absolute requirements for success include a modern, usable, and regularly updated website. Those things are all very important. But in addition to a website, we need to have a single phone number that's staffed by a human being full-time. Because a website isn't enough on its own, many people feel much more comfortable making a phone call, and these are problems that are complex, and often a static website answer to a question isn't going to be enough to answer the questions that people have. So we need someone who's an expert, who's very well versed in these different programs, who can answer questions. And the position must be paid, and the person in that position must be neutral. And that means not working with other organizations on the island already in an official capacity or at the same time that they're in this role, because we want people to be referred without bias for any particular organization. We also wanted to make a few notes on the populations who'd be served by this one-stop service. Seniors, obviously, those are the people who we most want to help with this program, but that includes people who might typically be disqualified outright from other kinds of services, like being too young for Medicare or having too high of an income for elder services on the island. We also want to make sure that we're addressing the needs of multilingual and multicultural populations on the island. That's a gap that came up over and over again in many of our interviews that we'll address in more detail later. We also want to make sure that we're supporting caregivers on the island who are living with an elderly parent, or decision makers living off the island who don't know the network as well as they would if they lived here, who are still going to need help deciding what to do with what to do for their parents. We also want to make sure that we have outreach and follow-up for providers. We can't expect a busy clinician or another provider of services to be able to constantly monitor any database that we publish and notice any subtle change or any new service there. So we want to make sure that the person in this role is reaching out to the right targeted community to let them know about new services, changes to existing services. And we want to make sure this person is able to close the loop on referrals by following up with the referrals that he or she makes. As an example with outreach, I just want to give a little anecdote here. The hospital has a new pain management clinic that just recently opened, I think within the last month. But the clinicians in non-hospital places on the island didn't know about it. And there really isn't a clear system for them to find out that that pain management clinic exists. And so they'll still be referring people to off-island pain clinics where they'll have to spend the money to go, it's money and time to go off-island to see treatment, come back. So we saw there a place for this outreach to go directly to clinics to say these are the targets that we need to reach to make sure that their patients are getting the best service they can. So we also wanted to address the role of the existing 4 Martha's Vineyard Councils on Aging. The seniors in every town on the island have similar needs. It's not going to vary very much between Chilmark, Tisbury, West Tisbury, so on. But those councils on aging, as it stands right now, are separate, and they don't share a common mission statement. We think it's extremely important that the councils on aging come together to establish what their mission is and to write a common mission statement. We can't provide the most efficient, high quality, and wide breadth of services without agreeing on what the goals are for the whole island and pooling resources to make those things happen. And when I say pooling resources, to start, that's an intellectual resource and knowledge of the different services that are available on the island. We found in our interviews that different councils on aging knew about different programs, and it wasn't equally shared. And we want to make sure that that knowledge is equal among all of the towns. We also want to make sure that we have strategies from the councils on aging to reach the younger old or the newly old, so those who are maybe in the 55 recently range, who don't think of themselves as needing to reach out to the senior center for services. And how do we make it hip for the 55-year-olds? We'll see. We also want to make sure, though, that even though we have this central shared strategic plan, that the councils on aging remain local in their ability to respond with agility to the needs of their seniors. So that means having a facility that seniors feel comfortable going to. It may not mean one in every town. We'll see what shape that takes. But when we heard from seniors, they said a few times that it's important to have a local place that feels like their home base, even if that means there's some shared services that they're using that are island-wide. I also wanted to mention what are the benefits of sharing a mission among the the 4 councils on aging. So these are some numbers from the Ohio model I mentioned earlier, and this is 5 counties, so it's a lot bigger. But just looking at these numbers, I was blown away. In 1 year, they provided 280,000 transportation trips to medical appointments and other senior center activities, and they received almost 30,000 phone calls from seniors looking for help. So if we scale that down, I didn't do the math on here, but I just thought it would be helpful to think about what a difference it can make to have this unified service across the towns that has everybody's common needs in mind. There's a lot of demand, and there's a lot that we can do to improve people's lives here on the island. Finally, funding. I know that's something that comes into everyone's mind whenever we talk about these new programs. So as an example, the Ohio model is funded 40% by Medicaid, 40% by county tax levies, and 20% from other sources, so public and private. That property tax levy, it varies by the county, and they have to vote on it every 5 years. But from the research I did, it's about $30 per $100,000 of property value every year, just for a sense of scale. And on that revote every year, they have usually about a 60 to 70% approval rate to do it again. So 60 to 70% of the voters aren't over the age of 65, but there's so much community support and there's so much clear benefit from this program that people are eager to continue it. The Vineyard Healthcare Access Program is the other local model I mentioned. Today, 80% of its budget is from the 6 towns. When it first started, it was 100% grant funded. So that's another example of a program that when it can prove its island-wide need and accessibility, there is political will to fund it and to make it stay alive. So our plan for the Seniors One Step, I've kind of talked about obliquely so far. There's an immediate need to have one person full-time who's going to take on the One Stop, will establish this database, answer the phone, and help people get to the services they need. Longer term, we'd like to expand, and that would include case managers, depending on the community need, who can help with more complex cases of navigating the different service systems on the island, and federally, and statewide. Potential barriers include funding, which we addressed a little bit on the last slide. Another important factor will be buy-in from every organization in the community. It's incredibly important that we don't have side streams of information or workarounds that will limit the size or the effectiveness of the One Stop. It needs to be the one phone number that services think of, that seniors think of, that their families think of, that providers think of whenever there's a need for seniors to access these services. So now I'm going to hand the mic over to Caroline. We'll talk about transportation.
Hi everyone. I just want to echo what Cuff said. We found that there are already so many existing organizations. It's really fantastic how much Martha's Vineyard has, and it would be fantastic to expand on some of those. But my name is Caroline Royer. I'm also a second-year medical student, and thank you all so much for coming. So I'm going to talk about transportation, which we think is particularly crucial for the population of seniors who want to remain at home, which I think many people want to remain in their homes for as long as possible. Unfortunately, if you don't have access to transportation, that can lead to social isolation. It can lead to poor access to medical care, even limited food supplies. So for some on-island existing services, the big ones we found were provided by the Vineyard Transit Authority, which, as you know, includes the fixed route known as the bus, which has drastically expanded since 2001 in terms of the routes that they're able to pick people up on. And what many people don't know is that it provides one-to-one travel training, which means that if someone is not acquainted with the public transportation system, is new to it, or just getting used to it again, they will provide service to, it can last a day or more, with a particular customer to help them get used to using public transportation again. It's a fantastic program that not everyone knows about, so we want to increase awareness about that. There's also the paratransit route, also known as the LIFT. That's available for people who are considered disabled under the ADA, and also for those people who live within about a mile of existing bus routes. So it covers a lot of people. There's also an organization called Vineyard Village at Home, which is a membership organization, and there is aid available. And this organization coordinates assistance with any task at home and in the community, but 95% of its use is for transportation, in which volunteers sign up and are able to drive elders to their friends' homes, to doctor's appointments, grocery stores, and other things of that nature. And we found that there might not be as much awareness about that as could be. There's also the Blueberry Van, provided by Island Elderly Housing, which provides transportation for any need on the island 3 times a week. And in terms of off-island services, these are very important because, as you know, unfortunately we can't get all the specialists here that we need in terms of medical services. So there's the medical taxi, which is provided by the Center for Living. It's funded by a grant provided by Elder Services, and it provides transportation to medical services on Cape Cod. There's also the Medivan, which is also provided by the VTA, and it provides transportation to and from Boston for medical appointments. Unfortunately, it only runs on Tuesdays, and there's a very limited time frame because of the ferry. So people can only have appointments between about 11 a.m. and 2 p.m. on Tuesdays. So in terms of needed services, as I said before, it would be fantastic to expand some of these services. And we would recommend expanding Medivan services because this will mean increased access to specialist appointments, preferably maybe 2 days a week in the next year or two, and hopefully expand to more, to about 5 days a week, if that's possible. We would also love to grow Vineyard Village at Home. We could increase the volunteer base by tapping into the pool of recent retirees, also students in the National Honor Society at the high school, and also we found in interviewing faith-based organizations that there's a lot of community support there as well. We should also increase the funding for aid through Vineyard Village at Home and increase awareness because, as I've said, not many people know about the program. 2 other needed services, adjustments to existing Hackney laws. I'm guessing many of you are aware that there are many taxi services on the island, and they are governed by different rules in each town. So this only provides one-way trips if you're changing towns. So, for example, if you go from Oak Bluffs to Edgartown, you can't take the same taxi ride back because you would need a different taxi company. In addition, we found there's a real lack of resources for transportation of veterans to VA hospitals in Providence and Bedford. Unfortunately, a lot of veterans do need to get their medical services at these 2 places, and currently they're relying on personal connections, friends who drive them, or simply knowing the Veterans Affairs assistant. Thanks very much for listening, and now I'm going to turn it over to Ismael Rivera, who's going to talk about medical care.
Hi, I'm Ismael Rivera, also a 2nd-year medical student at UMass. I'm going to focus on primary care, dentistry, and mental health. And you've seen some numbers from us about population growth overall. What we want to do here is just give you an idea that as the population grows, we expect the incidence of illness to expand in parallel with that. So there are more people getting older on the island. We expect greater incidence of diabetes, greater incidence of osteoarthritis, all in proportion to population growth. Now, one of the big problems with that is that a lot of these conditions require chronic ongoing care and maintenance through primary care, and we really feel that there's a problem with primary care on the island, that there's a shortage of primary care providers. There are long waits. Anecdotally, we've heard up to months for some people. And as a result, very often people end up at the emergency department for their primary care, which is expensive and not the best way to receive ongoing chronic care or primary care. There are non-hospital clinics on island. The Island Health Clinic, which is sometimes referred to as the rural health clinics, Vineyard Medical Services has a walk-in with some primary care appointments, and there are other clinics as well, but they're not well advertised and they're not well known by the general public. They also can't cover all the gaps that are there, and there's a real need to recruit more primary care providers. Language barriers and cultural competency remain a big problem. For those who don't speak English as a first language, we're really concerned about their access to care. Very often they can't get an appointment because they can't leave a message in their primary language, so they can't have any access to primary care. There are issues about minority groups and the Wampanoag tribe and cultural competency in those regards that are often unaddressed and not well looked at. There are additional care needs as the population gets older, becomes a larger portion. There's only one geriatrician on the island. There aren't many geriatricians nationwide, so we don't expect it'll be an easy process of trying to get additional geriatricians, but it's something to look at. Other specialties that there need to be access for, things like ophthalmology, endocrinology, and podiatry, these are all related to diabetes, which is a big concern for a lot of people on the island. We need to be thinking about access moving forward to these specialties both on and off island. Not all elderly persons will have access to Medicare as we move forward. Dental care is a huge gap, and it's a really important issue. There are no Portuguese-speaking dentists. Only one office is actually accessible to people with Mass Health, but there are a shortage of offices accessible to those with disabled. It's about half, anecdotally, is what we've heard. A lot of providers don't accept tribe reimbursements directly, which means there's a huge out-of-pocket expense. Medicare and Medicaid, Mass Health are all not well accepted. They don't accept private insurance very often. Sometimes they take cash only, and so that's a problem. Mental health is a big issue. Martha's Vineyard Community Services has done a great job, but they rely heavily on trained professionals. There's a high cost of the professionals who provide services on the vineyard. And this is also tied to housing and cost of living. If you can't provide adequate pay for these professionals to live on the island, which is hard enough already, it's hard to get people to come here and work in these programs. The primary point that we want to make here, though, is the core program. A lot of people think that the mental health issues aren't nearly as bad as they were in the past. Part of that reason is because the core program has done a very good job of getting people access to mental health on the island, outside of the hospital. And the funding's about to run out. It was designed as a temporary grant by the hospital for 5 years. We've got it just under 2 years to secure long-term funding. Hospice care has been really great, and it's one of the strong points of the island, but it's underused. The hospice organizations feel like there really needs to be a paradigm shift in how we think about hospice care. This isn't about preparing people for death. It's about providing people the best quality of life when they've been dealt a really lousy hand of cards. And we need to train both the population in general about the utility of hospice care, as well as primary care for providers. That hospice care is an important aspect of care generally. And there are gaps there too. People with Alzheimer's, dementia, Parkinson's, they don't always get access to that kind of care because it's hard to qualify whether or not they're in that range of people who should be in hospice care. So now I'm going to turn over the presentation to Kelly.
Hi, my name is Kelly Pace. I'm another second-year medical student from UMass, and I'll be talking a little bit about the issues related to housing on the island. When we came to the island and were prepared to look into issues related to healthy aging, we expected to hear things about access to medical care and as well as transportation and the ability to navigate the different services on the island. But was something that came up again and again and again in our interviews was the availability of affordable housing, not just for seniors themselves, but also for the people that will be needed in the future to provide services to them, the younger people that will be needed to come into their homes and provide nursing care or homemaking and other services like that. So we're going to be discussing both of those issues. So currently there are a number of housing options available to seniors on the island. Those range from public and subsidized housing, primarily through Island Elder Housing and through the Tribal Housing Authority of the Wampanoag Tribe. And there are a large number of seniors who are able to stay in their homes, either independently or with family members. And at the other end of the spectrum, there are assisted living facilities and skilled nursing facilities, more commonly known as nursing homes, where there's access to medical care 24/7. So currently there are a number of housing options available to seniors on the island. Those range from public and subsidized housing, primarily through Island Elder Housing and through the Tribal Housing Authority of the Wampanoag Tribe. And there are a large number of seniors who are able to stay in their homes, either independently or with family members. And at the other end of the spectrum, there are assisted living facilities and skilled nursing facilities, more commonly known as nursing homes, where there's access to medical care 24/7. So one of the important issues looking into the future is the expansion of affordable housing for the elderly. And as I mentioned before, there are two main organizations on the Island Elderly Housing and the Tribal Housing Authority, that currently provide those housing units. Right now there are about 165 units available in the Island Elderly Housing and 6 in the Tribal Housing that are reserved for elders. And given what we have seen before about the expansion in population over the age of 65 that will be coming in the next decades, there really needs to be consideration of expansion for these issues. And then in addition to this, we need to consider how can we promote more people to be able to stay in their homes as they age. And we have heard 3 main points that can be used to focus on to improve private housing. The first is the idea of universal design, which is a way of creating a more accessible home, if only for the purposes of visibility or ease of use. The idea is not to make every single new construction on the island, every private home, 100% accessible to people with disabilities. That would be great, but that's a difficult ideal to achieve. So universal design rather focuses on the visibility of a home. So having at least one entrance on the ground level that doesn't require stepping up for stairs, or having doorways that are wide enough for a wheelchair. If we can, as a community, come together and change our mindset about design, and when we're thinking about new constructions, incorporate some of these ideas, it makes a community that's more welcoming, not just to elders, but makes homes that will be easier for people to live in as they continue to age and be able to stay in their homes. Another important issue on the island is the idea of overhousing. Many of the homes, the vast majority of homes on the island, are single resident dwellings. And when people move here in their younger years, they're buying a home for them at that moment, and they're not necessarily considering what their needs will be as they age. So in many cases, seniors find themselves in a home that's much larger than they need or that they can care for, and are sometimes isolated. So in other communities, there have been attempts at cohabitation models, which are essentially having either a senior move into an extra room in another home, or having other people move into the extra rooms in the home of a senior. And one of these places where such a model has worked is Philadelphia, and that system involved careful screening of applicants and a trial period to make sure that groups were comfortable living with one another. And finally, another community approach to helping seniors stay in their homes is to consider aspects of zoning that would allow for multi-generational homes, and also allow for construction of residences that have greater density in more developed parts of the island that can support larger buildings with infrastructure such as sewer and water. And finally, at the other end of the spectrum of housing needs for seniors are assisted living and nursing homes. And what you can see here is the current and projected estimates of population on the island who will have a series of chronic conditions that are commonly associated with having to go into a nursing home for care. I know they're difficult to see, but they include things like osteoarthritis, falls, Alzheimer's, stroke, Parkinson's, things that will require in-house medical attention. And this next graph shows those, all those conditions combined, and you can see that there will be a significant increase in the population who will be faced with these chronic conditions over time. So we're not suggesting that all 2,500 people in 2010 with those kinds of conditions are in nursing homes, but rather that the same proportion that are requiring nursing home and assisted living support right now will also be needed in the future. So as the number of people over the age of 65 increases, the number of people with these chronic conditions that may require nursing home care will also increase, which suggests that there will be a greater demand for these types of facilities. So as I said, we will expect an increased need for skilled nursing. And as we look to the future, we need to consider not just that there need to be more facilities, but more facilities that are friendly to seniors. And one of these models for the future is the greenhouse model, which is currently being incorporated even now. And the idea of the greenhouse model is that a nursing home is more home than about the nursing. And it has received a lot of approval from seniors themselves and has been a very effective model across the country. And finally, as I mentioned before, it's really important to not just consider the housing needs of the elderly, but the housing needs of the people that will be supporting them. We're going to need a lot more people coming into homes to provide nursing. We're going to need more people for counseling services. All of these things that benefit the seniors on the island. If we're going to have more seniors, we need more support staff. So one of the important things to consider moving forward are the findings of the Martha's Vineyard Housing Needs Assessment. It's an assessment that has been completed several times over the last couple of decades. And 10 years ago, it made the recommendation that 150 affordable housing units be produced each year. And that's a mixture of homes to be purchased by homeowners and then also affordable year-round rental units. And currently, there's an average production of around 30 such units a year. So there really needs to be improvement. If you don't build affordable housing, the support staff that's needed in the future won't be able to afford to live here and support the seniors. Okay, so I'm going to pass it off to Gosha.
Hi everyone, my name is Gosha Smaz, and I'm an adult primary care nurse practitioner and student. Sorry, I guess I'm a little nervous, but so I'm going to talk about how can we allow seniors to stay at home longer and live healthier lives. So what we're going to focus on is social isolation and community support. And so staying at home provides its own risks. And those are social isolation and putting a strain on caregivers and placing the residents at risk of just injury, risk of unhealthy situations, poor hygiene, things like that. So one of the programs that we fell in love with on the Vineyard is the Supportive Day program. It's provided by the council, the Center for Living, and it's provided 4 days a week from 9 a.m. to 3 p.m. And it provides social support for the islanders in a safe setting. So the social support that I'm talking about is activities such as art, music, family dinners, having people coming in and giving talks to the seniors and having them learn something, providing structure into their lives, which is really, really great for dementia and Alzheimer's patients. And it's also a safe setting and providing that supervision in a 1-to-4 member ratio. It also provides great support for the caregivers. So the caregivers need a break also. A lot of them are older and they also need to focus on healthy aging. And to do that, they need time to join the Y and they need time to pursue the things that they also want to pursue. And so such a program allows them to do this, and that's very, very important. And so it's a lifesaver for the caregivers and for the members. And the cost of the program is $40 a day, but there is aid available from Elder Services as well. So we recommend to expand this program. And to expand the program, it needs a home. So currently, it's located in 2 locations, in Tisbury and in Edgartown. in utilizing the senior centers. So you can imagine this provides a lot of trouble for everyone involved. So for the staff, they have to carry their things back and forth, remember all their files and everything else. This is just a funny image that they had on their website showing the trouble that moving things around can cause. Also, it causes trouble for the clients who are already a little confused sometimes, and having one location will help them with their treatment as well. And lastly, it's confusing for the caregivers who have a lot going on anyways, and they don't need to worry about what day they have to go to what location. So the need also is very large. And so 22 families are enrolled currently, 14 are on the waiting list, and if they promote the program anymore, they can't help them. So having a larger facility will provide them the ability to do so. So there's a few locations being considered, one of which is at the airport, and also some people mentioned including it at the Y, and that would allow for a community center. And also having a location provides a safe area to have this program. So for example, the Tisbury Center has 6 exits, and all of them are open to the public. So imagine being a staff member and having to count heads all the time, making sure that everyone's there and everyone's safe. So that's something else to consider. And we also want the program to expand from 4 days to 5 days, and maybe eventually 7 days. And we are also considering transitioning to a medical social model. So currently, as I mentioned, the social activities that they provide, but potentially maybe including medical care such as CNAs and nurses for medication management, specimen collections, counseling, things of that nature. So expanding the program to also late-stage Alzheimer's and dementia patients as well. Another program that we'd like to consider is a volunteer stop-at-home program. So we envision 1-hour stops at elders' homes, and this would allow for socializing and also making sure that everything's okay in the home and with the senior. And this, we would like to include volunteers from the Council on Aging as they're going to different activities. They can stop in maybe and say, hi, how's it going? How are things? And just making sure everyone's okay. And also we could potentially tap into a volunteer pool at the National Honor Society at the regional high school, and recent retirees, and also faith group members. And lastly, another program we'd really like to amp up is the Gatekeeper program. So it was started 20 years ago, and this program allowed for individuals to call in and report something that they thought was maybe unsafe for an elder or someone in the community. So this program somehow has lost momentum, and I think it's very important that it starts up again. And so what we would like to do is the program that we suggested, the referral system, the one-stop referral system, to also be a unsafe, unhealthy reporting system. If you see something, you can call in and they can refer that person, check up on that person to the right services that they may need. And this program would require island-wide education. Other programs so people know that they can do this. And now we'll go over our recommendations again.
Sure. Thanks, Gosha. So we've chosen this picture on purpose. It's a path to a beautiful beach on Martha's Vineyard. This is up in Aquinnah. So we're hoping that the recommendations we've presented today, that we're going to just summarize, give you an idea of what we think the path forward is for building an island where it's healthier and safer and more enjoyable, more pleasurable to grow old. So let's start with our longer term recommendations. These are the things that reflect what we heard from the community, from different organizations, and from seniors themselves about what would be the magic wand change they'd like to see on the island. Some of you may remember us asking you that question. So first up, island-wide strategic planning. One of the elements that needs to be part of that strategic plan is a way to increase the language and cultural competency for the different services available on the island, whether that's medical, healthcare access, the one-stop, things like that. We also need to consider housing options for seniors and workforce. I know that you live on Martha's Vineyard. You've heard about this many different times from many different groups, and we're here to reiterate it. It's extremely important that we address the housing needs for seniors in the workforce. The way we suggest we do that is by building the political environment to support the growth of what we call lowercase a affordable housing. It doesn't need to be publicly supported to be affordable, and it's important that we consider those implications. We also need to prepare for the increased need in skilled nursing facilities, and that means planning and building those facilities as the community needs them. We also need to, in terms of medical care, explore incentives to recruit physicians and other clinicians to the island. There are loan repayment and loan forgiveness programs that can be very effective for rural and underserved areas in getting clinicians to come and work in that place. Finally, in terms of support for independent living and for non-professional caretakers, the family caregivers on the island, we need to establish or reestablish the Gatekeeper program and the volunteer stop-at-home programs that Gosha just mentioned. And that will take some time to get up running, but the sooner we can get that started, the better. And we know there are a lot of people on the island, like we mentioned, who are eager to take part in making these solutions happen. We also want to expand transportation options and access, especially off-island. So as Caroline mentioned, expanding Vineyard Village at Home, expanding Medivan, looking at funding for MediTaxi. We also need to ensure that the Center for Living can expand the supportive day program. And that's another thing that Gosha just mentioned. One thing that she mentioned that I'd like to repeat is how many times we heard from the clients at the Center for Living and their caregivers that the supportive day program is a lifesaver. And I think that word is really rung true for us, and we really want to emphasize how important that service is on the island and how crucial it is to expand that service. So we'll move on now to our more urgent recommendations. These are the things we wanted to have in your minds last so that you leave this presentation thinking about these. We want first to develop a unified mission for the Councils on Aging and Martha's Vineyard. We went into why that's so important. You saw the Ohio model and what kind of things we can expect from having unified council on aging, and I think there's a lot to be gained from it. We also want to establish the seniors one-stop referral service that we mentioned. In terms of medical care, we have an immediate need to recruit geriatricians and psych providers. It doesn't necessarily need to be psychiatrists. It can include psychologists, social workers, other people who are able to help with psychological needs and mental health. We also need to expand the dental care options on the island, especially for those who don't speak English, for those who are low income. Those resources, as Ismail explained, just aren't very widespread, don't address all the needs of the community right now. We also need to find a way to continue the funding for CORE, which is the in-home mental health counseling program that is expected to run out of funding in the next 2 years. Finally, we need to find or build space for the Center for Living Supportive Day program. Again, can't emphasize it enough how important this program is to the health of the island, to the caregivers, and to the providers. Everybody here who's involved in healthy aging really will benefit from the expansion of Supportive Day program. So that concludes our recommendations for this presentation, but we have about 15 minutes for questions. We're eager to hear from you, to hear feedback on these suggestions. And we also wanted to thank the Peter Temple and Patty Moore, who really helped us a lot in preparing these recommendations and this information for you. So I'll open it up to questions. Thanks so much for your attention during the presentation part. Any questions? Yeah.
I'm here representing the island clergy, although I am not one.
Okay.
But I come from the Buddhist Center. But in reporting back to them, there's a website that I can find all this information on? Like
The presentation?
The Donors Collaborative website by Monday will hopefully have this entire presentation
Okay.
On it.
Great.
So I just want to repeat that into the mic, that this presentation will be available online on the Donors Collaborative website by Monday.
And also, the Dukes County Health Council website should have it as well.
Great. Thank you so much.
Sure. You also have a question?
Great presentation. Thank you, everybody. Everybody did a great job. County Commissioner and the Selectmen. One of the things that, having said all that, did you look at, it seems to me we lack links to the Cape and to the mainland. And, did you guys look at that? I didn't really hear, I'm not criticizing, I'm just asking that when you talk about regional, well, you don't use the regionalization word, which is very smart. But when you talk about, that's something we really need to grasp with here. It's very difficult, but we need to grasp. But also, did you look at strengthening, which I think are very weak, ties with the Cape and resources?
I see you nodding vigorously, so I think we should take that.
So the question was just for the microphone and recording. The question was, have we looked closer at strengthening ties with the Cape? We had a very broad mandate, and we talked to a number of organizations about a lot of different things. We felt from what we looked at that there were real needs to address issues on the island and to create a unified island vision. And I think that it's going to be hard to effectively have the island approach issues of ties with the Cape generally unless there's a unified vision. I think it can be done. We certainly think that there are recommendations in here about transportation, about access to specialty services off island, and that's a key component of well-being overall. But for our purposes right now, I think that's a little bit beyond the scope of what we can realistically could have accomplished.
So also in reference to that question, there are a couple of services that are currently in existence on the island, sort of straddle that line between Cape and island. One of those is Elder Services, and the region that Elder Services works out of, their main office is in, I believe it's South Dennis. And so a lot of the services, they come through the office that's here that's based in the hospital. But one service that they mentioned there's trouble in connecting the Cape and the islands is Elder Protective Services. So for example, they have all of the staff, the trained staff, that it requires a lot of training and maintenance of training to run an Elder Protective Services, and all the staff is based in South Dennis. And we've heard that it's sometimes difficult to get Elder Services to, the protective services to come here and to be here enough. But at the same time, there's not as much of a need in terms of population for the services. So the balance between having the service available to the island here and also having enough training and having enough of a population to support the need for that staff person, it's difficult to match that. So that's one example. The VNA also has physicians who sometimes, I'm sorry, not the VNA, the Veterans Health Affairs sometimes has physicians come to the island because it's easier for them to refer to VA hospitals. But again, there's not enough of a demand and enough to support the person full-time here on the island. And so sometimes that's difficult to get the appointments and get the referrals where the person's coming once a month along those lines. So.
I know one thing that the island clergy has really been focusing on these last years is homelessness in the community and trying to address some of those issues that aren't sort of very public. Did you find any talk about elderly island homeless in your research?
Yes, so the question was whether or not we had heard about the issue of homelessness, especially amongst the elderly on the island. It was an issue that was brought to our attention when we met with the clergy, but also from other organizations. Currently, there's no what you would call safety net housing for people who are homeless. And unfortunately, we heard several anecdotes of seniors who were homeless for various amounts of time, or were living in a tent, or were living in a car. We heard one story about a woman who was diabetic and had to store her insulin in a cooler in a car, and that's just, it's not ideal and it's not great. And currently that's another sort of Cape and Island shared service. The homeless shelter, I believe the nearest one would be in Falmouth. And so Hyannis, people have to go off island if they want a shelter, which is a barrier and also is difficult for people who want to stay here in their home. So it was an issue that was brought up multiple times and should be considered in the larger issue of affordability of housing and housing on the island, definitely.
I have a question about the issue of scale. You mentioned it in terms of the protective services. And the Ohio one-stop model has 250,000 people. We have 17,000 people. Do you think that that can be scaled down to our size?
So the short answer is yes. The 250,000 is actually the population over the age of 60 in that region. So it's even more populated, so it would require even more scaling down. But I think what's important to realize is or important to incorporate in that scaling down is that this community contribution via tax levy or some other kind of policy can be a huge source of support for the elderly population in a community regardless of its size. I think one of the things in Martha's Vineyard that is especially impressive that probably doesn't exist to the same degree in most other communities, especially one as large as Southwestern Ohio, is the volunteer core here. And for example, with Vineyard Village at Home, I know Polly came in, that provides a huge amount of transportation for senior members of the organization, and that's all volunteer based. So we've heard from community members, from organizations, that there's a real drive to volunteer, to be part of it. And I think that the challenges that we may find in being able to pay for complicated infrastructure, complicated administration, won't necessarily be costs that we'd face on the island because it's a smaller community, because there's such a strong volunteer base here. Obviously, we haven't modeled those numbers for how we would scale them down, but I think that proportionally, the size of the elderly population is about the same countrywide. It will be higher in Martha's Vineyard than the rest of the country, but that doesn't mean it's prohibitive in terms of scale. Sure, yeah, of course.
To add to what Cuff was saying, I think a lot of us have been impressed with how strong the sense of community in the towns are, and we really do want to preserve that and think about what we can do in terms of having an island-wide vision similar to the Southwestern Ohio model, which includes even more, what was it, 5 counties? It has 5 counties and many towns. So I think if they were able to develop some core issues and values and a unified mission, I think that would be possible here while still preserving local governance and local control.
One of the things I think is really important to bear in mind about the One Stop is that Martha's Vineyard is unique in that there is so many services and so many people willing to work. There's just a ton of things that are available to people, and navigating that is exceptionally difficult. And one of the primary reasons why we want to have a one-stop shop for referring people to resources is because it is so difficult for people to find the resources they actually need in the sea of things that are out there. And in that regard, I think the Ohio model is beneficial because they're dealing with a lot of services from a lot of different places, and they're able to pull them together. Here you have a lot of services in a very short space, and I think it's really possible to pull them together in a very clear and concise way. The other thing that we shouldn't confuse the issue is our idea about a unified vision for the councils on aging. We're not necessarily saying that there should be centralized management of the councils on aging. We just think that they need to come together and have a unified vision above and beyond the individual communities, so that they all are on the same page of what their services are to some degree. And they need to be individually responsive to their communities. Each senior center for the councils on aging has to be responsive to the community it's in, and has to have some degree of local management. But there needs to be an island-wide vision of the future, because it's going to be such a big problem of an expanding population that the island may not be prepared for.